Tuberculosis TB is a bacterial infection that usually affects your lungs. It can also spread to other organs. It's treatable with medications but can be fatal if not treated. Tuberculosis TB is a potentially serious infectious disease caused by Mycobacterium tuberculosis. It primarily affects the lungs but can spread to other organs. TB remains a significant public health challenge, especially in low and middle-income countries. How does tuberculosis spread? TB can spread when a person with active TB coughs, sneezes, talks, sings, or laughs. Only people with an active lung infection are contagious. You usually have to spend a lot of time in contact with someone who's contagious to catch TB. Most people who breathe in TB bacteria can fight the bacteria and stop it from growing. This causes a latent TB infection. 1. Causes of tuberculosis. TB is caused by Mycobacterium tuberculosis, a slow-growing bacterium that spreads through the air when an infected person coughs, sneezes, speaks, or sings. Risk factors for TB infection: close contact with an infected person, weak immune system, for example, due to HIV, AIDS, diabetes, malnutrition, cancer therapy, poor living conditions, for example, overcrowding, poor ventilation, smoking and substance abuse, healthcare workers exposed to TB patients, travel or residence in high TB burden areas. 2. Signs and symptoms of tuberculosis. TB can be pulmonary, affecting the lungs, or extrapulmonary, affecting other organs, like lymph nodes, bones, kidneys, or brain. Pulmonary TB symptoms: most common form: persistent cough for more than 2 weeks, coughing up blood, hemoptysis, chest pain, unexplained weight loss, night sweats, fever and chills, fatigue and weakness, loss of appetite. Extrapulmonary TB symptoms depends on the affected organ: lymph nodes, swollen, painless lumps, bones and joints, bone pain, fractures, joint swelling, brain TB, meningitis, headache, confusion, neck stiffness, kidneys, blood in urine, abdomen, pain, swelling, diarrhea. Diagnosis and tests. How doctors diagnose tuberculosis. Healthcare providers use a skin or blood test to diagnose TB. You might also need lab tests on sputum and lung fluid, chest X-ray, computed tomography, CT scans. 3. Prevention of tuberculosis. Primary prevention: avoiding infection. 1. BCG vaccine. Bacillus calmette-guerin BCG vaccine protects children from severe TB forms. 2. Infection control measures. Avoid close contact with TB patients in crowded spaces. Improve ventilation and sunlight exposure in homes and workplaces. Wear masks in high-risk areas, for example, hospitals. 3. Good hygiene practices. Cover mouth and nose when coughing or sneezing. Wash hands regularly. B. Secondary prevention: early detection and treatment of latent TB. Screening high-risk individuals, HIV-positive people, healthcare workers, contacts of TB patients. Treatment of latent TB infection, LTBI, with medications like isoniazid or rifampin to prevent active disease. 4. Treatment of tuberculosis. TB is curable with proper treatment. The standard treatment lasts 6 months but may be longer for drug-resistant TB. First-line treatment for drug-sensitive TB-DOTS: directly observed therapy, short course. Intensive phase: first 2 months. For drugs: rifampin R, isoniazid H, pyrazinamide Z, ethambutol E gives HRZE. Continuation phase: next for months. 2 drugs, rifampin R and isoniazid H gives HR. B. Treatment for drug-resistant TB: MDR-TB, XDR-TB, MDR-TB, multi-drug-resistant TB, resistant to rifampin and isoniazid, requires longer treatment, 9 to 24 months, with second-line drugs, for example, fluoroquinolones, bedaquiline, linezolid. XDR-TB: extensively drug-resistant TB, resistant to first-line and some second-line drugs, requiring specialized treatment regimens. C. Supportive care and monitoring. Regular follow-up to check adherence and side effects. Nutritional support for TB patients. Treatment of coexisting conditions, for example, HIV, TB co-infection requires antiretroviral therapy. 5. Importance of completing TB treatment. Stopping TB medication early can lead to relapse, infection returns, drug resistance, MDR-TB, XDR-TB, transmission to others. Patients should adhere to their treatment regimen and seek medical help for side effects like liver toxicity, vision problems, or severe gastrointestinal issues. Conclusion: TB is a preventable and treatable disease, but it remains a major global health challenge. Early diagnosis, proper treatment, and preventive measures can significantly reduce its spread. Public health interventions, vaccination, and awareness are crucial in controlling TB worldwide.